Hey teams, Lauren here with BizRock. In today's video, I want to talk to you about an important form of communication, specifically verbal communication. So oftentimes we spend time on verbiage, which is the words that we use. Or if you've seen some of our videos in the past, we talk about communication with regards to gestures. Now, there's a researcher, he's a famous researcher, and if you've ever studied any form of communication, surely you've come across this scientist. His name is Albert Mehrabian. So Albert created and founded this amazing rule called the 7-38-55 rule. Now, those are all percentages, so 7%, 38%, and 55%. Today, we're going to talk about the 38. So 7% he found is words that we use, and this attributes to somebody's buying decision. 38% is with regards to communication, specifically our verbal communication. And then finally, 55% attributes to our nonverbal communication, our gestures. So, and today we're going to talk about the 38%. So that's that verbal communication. So if you're watching this, you might be like, okay, Lauren, I hear you, but what do you mean verbal communication? You said it's not the word, so what is that? So verbal communication is everything except for the words. It might be the volume in which we're speaking, or if we're speaking really low, that's volume, right? If you need somebody to really pay attention, you might whisper and get a little lower with them so that they'll lean in and they'll hear you a little more. Or if you're trying to get the attention of your room in your office, you might speak a little louder to kind of gather people's attention and get them to refocus. So you want to find the volume that works for you, but what I would encourage you to do is also match your patient. So if your patient's speaking really loud and you're like, well, gosh, Lauren, I don't want to speak really loud, speak a little softer, speak a little slower, and they will start to match you. So it's a really powerful tool to control the conversation, but also get the patient to meet you where you are. So volume is a form of verbal communication. Another couple forms of communication is pace and tempo. So for our clients in the north, they speak really, really, really fast. And they always laugh whenever we do trainings because we're from the south and we make them bring it down a hair or two, right? And so pace and tempo is very powerful. But you want to meet your patients where you are. So if you're in the north and you're speaking to your patients in the north, and maybe that's just where you're from, you might speak a little faster. That's okay. Meet your patients where they are. Pace is powerful, but it's also a type of style of communication that makes your patients feel comfortable. Now, in the South, we take things a little slower. And so we might speak a little softer. We might speak a little slower. Especially if we don't have anywhere to be. You know, the elderly population, they might not have anywhere to be either, and so they might speak a little slower. So you've got to meet your patient where they are, and pace and tempo will control that conversation with your patient. So far when it comes to verbal communication, we've talked about pace and tempo. We've talked about volume. Style is another form of verbal communication. Now, you might have a different style whenever you're hanging out with your friends and buddies on the weekends versus in the office. Our style, hopefully, is a professional sort of communication. So you want to have professionalism in the dental office, obviously, but you want to have a professional style. Now, I don't want you to lose yourself, but if you have slang talk on the weekends, or if you speak like a sailor, as they say, you know, save that for your free time. Save that for the weekends with your friends and family and buddies. But in the dental office, you want to have professional verbiage. You want to have professional communication with your patients. So don't lose yourself. Be you, right? But make sure you understand and know your surroundings. So style is important to serving our patients, to meeting them where they are. Pace and tempo can control a conversation. But the most valid one of all of those, the one that I think is most important, is volume. If you can master volume with your patients, you can bring them up to meet you where you are, or you can slow them down and bring them where you are. So it's a really powerful thing. The last thing I'll say when it comes to volume is if maybe you're a physician and you're watching this and you're speaking about an extensive treatment plan with your patients and you're like, gosh, this is a really serious procedure. We're gonna really talk through some things and I need my patient to hear me and understand and listen. One of the most powerful things that you can utilize is volume. Speak a little slower because they'll lean into you. They'll try to hear more of what you're saying. They'll probably be reading your lips at this time. So if you have a lower volume, It's very powerful in capturing your patient's attention so that they will meet you where they are or where you are, and they will match your same volume, but they will also start to listen intently. So master volume, practice pace and tempo. But what I would also say is role play this, guys. One of the best things that you could do is practice as a team. If you need help, reach out to our team. We're happy to help you and serve you in any way. But mastering these types of verbal communication, remember, it attributes to about 38% of a patient moving forward with us. So I always tell team members and offices, just because a patient came to us, just because they came to us one time, doesn't mean they're coming back. We have to continue to remind them of why they chose us. They chose us because, yes, we have high quality dental care, but most importantly, we communicate and connect with our patients. We meet them where they are. We guide them. We make them feel special and as if they are the most important patient of the day. Communication has the opportunity to do that. So if you need help, reach out to us. Go to bizrock.com. We'd be more than happy to help you. Otherwise, for our teams and our practices, we can't wait to see you and serve you soon.